So, in today's session, we are going to touch upon what is survival time, what is event, what is outcome of interest. So, let's see. Survival analysis is the collections of statistical procedure for data analysis, for which outcome variable of interest is time until the event occurred. What do you mean by time? So time, it could be like in month, in years, in weeks, or in days. So now how we are measuring them? So we follow up the subjects from beginning until the event occurred. So this is how we count the time. We follow up the subjects from the beginning until the event occurred. And alternatively, what we are doing here, we are counting age of the subjects when the event occurred. From the beginning, what was the age of the subject, and when they reached to the when the event occurred, what was the subject's age. Now we understood time. Now we'll move to the next to discuss about events. Events, here we can see example of death, disease relapse or recovery. So disease relapse means reoccurrence. Like relapse, it means the event occurred again. Say suppose subjects got cured for some period of time and again the event reoccurs. Death, we all know that. Disease indications, relapse from remission, it's nothing but like subjects was cured and relapse, it means after some time again subjects got the event, so relapse from remission. Recovery, it means subjects got cured and back to their work in daily routine, so it means the subjects recover. So event can be death, disease indication, relapse from remission, and recovery, or any designated experience of interest that may happen to the subjects. Apart from this example, any experience of the subjects, any event that may happen to the subjects called as a event. Although more than one event may be considered in the same analysis, we'll assume that only one event is of the designated interest. So our interest is, our endpoint is, we are looking the number of subjects until they alive. So our event is death, but it could happen before the event that occurred, the subjects has any severe event, and due to that he or she move for their elective surgical procedure. So in this case two events occurs. So when more than one event is considered, as I shared the example like death from any severe cause, so first severe cause happened and then death. So this problem can be characterized as either a recurring event or competitive risk. We will discuss in different session because this topic needs a detailed explanation. So let's focus on the survival time. So now we got to know the events, what we events called. It could be event can be a death, disease indication, relapse from remission, or recovery. We also typically the event we called as a failure. So because the event of interest usually is death, disease indication, or some other negative subject's experience, and due to the negative subject's experience, name called as a failure, event as a failure. But sometime in the survival analysis, it could be a positive experience of the subjects as well. Like here you can see time to return to work from an elective surgical procedure. So after elective surgical procedure, subjects went back to their daily routine, they started working. So it means the event can be the positive event also. So here your failure is a positive event. Now we'll see the examples, how we can identify from the example that what is time, what is event, and what is outcome of interest. So first example is study that follows leukemia patients in remission over several weeks to see how long they can stay in remission. So I'll just explain in very short what is leukemia patients. In leukemia patients, their bone marrow produce a large amount of abnormal blood cells, and over time this can be a cancer cells and also spread to other organs, tissues or any other organs throughout the body. Now coming back to our example, so from this example it says that following up leukemia patients in remission, we know that remission over several weeks to see how long they stay in remission. We got to know from this week that our time is in weeks. An event is because we say that like how long they can stay in remission. So your event would be going out of remission, because then only your event will occur. Now outcome of interest. So it would be time in week until person goes out of remission. Then only, because we are following up the subjects from the beginning. So we are following up the subjects from the beginning and until they are going out of the remission. So when that day the person will go out of remission, from beginning to till that day, it would be your survival time. Now in the second example, it's let's consider that 13 years follow up of a elderly population whose age are 60 years plus. So how long they remains alive? So from this example, the patients are already 60 plus years and we are following them till 13 years. And our interest is interested to see how long they can alive. Here your time is in years and your event would be death, because the day person will die, your event will occur. So event is death, outcome of interest is time in years until death. Say suppose you are following the subjects till 13 years and at 12th year subjects died. 12th year would be your outcome of interest. So third example could be that how long patients survived after receiving a heart transplant. So here also we are checking how long patients survived. It means your event is death and your time is in month, and your outcome variable of interest would be after receiving a heart transplant. So time in months until the death, because we are following up the subjects from heart transplant and then until they died. So this would be your outcome variable of interest. I hope this is clear and it helps you. Let's meet in next session where we'll be discussing what is censoring data in the survival analysis.